Mrs. Jones is a paranoid schizophrenic who suffers from confusion, an inability to make decisions, and believes people are out to get her. She is homebound and relies on her daughter to get to her doctor's appointments. Mrs. Jones also has multiple medical issues, but because of her schizophrenia, she has trouble organizing and prioritizing, especially tasks related to her medical care. Dr. Chen senses that the disorder is contributing to Mrs. Jones's ill health. He refers her to the medical team's Journey Behavioral Home Health Program since he realizes she needs help with the schizophrenia before she will allow anyone to help her with her other medical issues. Without a program like Journey, she may eventually need more costly inpatient care. Mrs. Jones's daughter, Susan, is her mother's guardian. She didn't realize she could ask for help at home with her mother's behavioral health issues. Carla, the behavioral health nurse assigned to the case, calls Susan to discuss how to help her mother remain healthy and continue living independently. She requests consent to begin treating Susan's mother. Mrs. Jones is in denial that she needs help and resists Carla's entry. Carla, who is experienced working with mentally ill patients, uses her communication and listening skills to build Mrs. Jones's trust. She explains that she is here to help at Dr. Chen's request and tells her there is no cost since her insurance covers the visit. Carla eventually gains Mrs. Jones's confidence and her agreement to receive services. This trust-building process is vital to Carla's ability to address Mrs. Jones's multiple needs. She conducts her initial assessment, which includes functional and cognitive assessments, an evaluation of vital signs, and a screening for psychoses. Carla explains that they will develop an individualized care plan together to help Mrs. Jones feel better. To avoid increasing Mrs. Jones's paranoia, Carla takes detailed notes only after the visit. Carla continues her visits to treat Mrs. Jones and build a trusting relationship. Mrs. Jones, under Carla's supervision, begins taking her medications regularly, including antipsychotics and an antidepressant for her anxiety. Carla also teaches Mrs. Jones coping skills to better manage daily tasks and helps her follow through with calls to her doctors. Eventually, after a series of visits from Carla, Mrs. Jones's mood is stabilized with the correct medications and her paranoia is alleviated. As a result of the Journey program, she also develops skills which improve her quality of life and enable her to stay healthy. If your patient or loved one could benefit from the Journey Behavioral Home Health Program, please contact us to learn more.